Well, into our Kickstarter this morning, it's going to be a very interesting conversation because this is something that we live by the way, and I'm talking about air. We breathe air, we think air, and we speak air. And if that air is taken out of your body, trust me, you would be 6 feet under. But there's also the quality of air and the state of air that you breathe. So this morning in our Kickstarter, we're going to be looking at assessing Kampala's air quality. My name is Priscilla Regina Naloga. Welcome to our Kickstarter. Now, the backbone of it being that this week is Air Quality Week, Awareness Week, that kicked off on Labor Day, 1st May, stretching all the way into tomorrow. And this time frame corresponds with the beginning of the ozone season, wildlife seasons, and then there's also the Asthma Awareness Month and the World Asthma Day. Of course, this is a disease that is respiratory related again to the air and the quality of air that you breathe in. Now, this creates a great opportunity to engage your community in air quality awareness activities. The theme for this year is very simple: working together for clean air. Now, Air Quality Awareness Week also highlights resources that increase air quality awareness and encourages people to take action and incorporate air quality knowledge into their daily living. And that stretches from when you wake up to when you return to your own house. All that air that you breathe in the different places that you're in, the bathroom, the public toilet, the office, the meetings, the outings that you go for, you're breathing in different versions and qualities of air. How that affects your daily living is something that we're going to be talking about. So basically, at the end of the day, you and I deserve good air to breathe in, and we're looking forward to a sustainable future that responds to the challenges presented by climate change. Now, this morning, I do have Professor Engineer Bainomugisha from Makerere University, who develops low-cost sensors to monitor air pollution around 120 towns in Uganda. You're most welcome, Professor.
Thank you.
Good morning.
Good morning. Good morning to you guys. Thank you for having us.
Okay. We're also joined by Dr. Daniel Okello, Director of Public Health and Environment. That's at KCCA. Good morning to you, Doctor.
Morning, Priscilla. Glad to be here.
Okay, let me pick it up from Professor. It's been a year almost since we last spoke in Morning at NTV, and you were rooting and advocating for good quality air. And of course, you did give us measures that we could adopt in our daily lives, but also sensitivities to which places have quality air and what are the things that cause that quality air to exist in certain parts of Kampala and not exist in other parts of Kampala. Could you give us a recap of that and where we stand 1 year later? Have we improved in our air quality awareness, or are we failing?
Yeah, thank you. First of all, just to say that it's a pleasure to talk about air quality because, as you've rightly said, each one of us breathes air, and every breath that we take, we are taking in air into our body system, and therefore it's important that each one of us we put importance on the quality of air that we breathe in. In terms of the progress we've made over the years, I would say that one of the major milestones we have now is that we have the ability to actually know the state of our air quality. Because that's been like a major foundation. Even before we start talking about the progress, are we actually able to monitor and measure the state of air quality? And in the past 1 year, we've been able to expand the air quality monitoring, working closely with the different partners, KCCA and other partners, to expand the infrastructure in terms of monitoring air quality in Kampala, but also other cities. And how does the data look like? In terms of the data that we have, what we see is that our air quality on average is still way above the recommended guidelines. As you might know, the World Health Organization recommends that the average concentration of some of the pollutants like particulate matter, 2.5, should be within the range of 15 micrograms per cubic meter. But we still see that in certain months of the year, we can go as high as, in some areas, as high as 5 times the guidelines, or as high as 10 times the guidelines. So there's still work for all of us to do in terms of improving air quality in our cities. Yes, we see progress in terms of awareness, people talking about the air pollution issues, and the implications it has on our health or environment and many others, but would like to see more action. And it's the reason why we have this annual Air Quality Awareness Week, to raise awareness on the matter.
In terms of indicators for these air quality checks and the things that are causing our air to be contaminated and therefore not good for us to consume, what are those indicators that we have seen growing in the last 1 year?
Yeah, in terms of the causes of air pollution, the key categories still remain the same. We know that one of the biggest contributors to air pollution is the biomass, the use burning biomass. This could be either in terms of cooking and other energy sources. We also know that the practice of burning garbage is also one of the biggest contributors to air pollution. And we still have the challenge of vehicle emissions, because most of our vehicles on the roads are pre-owned vehicles that have been on the road for many years, but also poorly maintained and serviced, and therefore they are contributing to the emissions that we are seeing in our cities.
Okay, all right. Dr. Daniel Okello, under KCCA, I know that this Quality Awareness Week means a lot. What is it about exactly, and how are you actually rolling out this campaign, creating awareness to the population here within the capital city?
Thanks. One of the things with air quality is you cannot determine it visually by just looking at the air, and in most cases that this air is clean or this air is unclean.
Doctor, in Kampala we can. You look at some places and it's dusty, the air is just a bit brown than other places.
Yeah, but it's fleeting, because after a while it will clear and you'll think now everything is well. And so what we are doing is to put a number to that, such that people can be able to understand that at this level the air quality is poor. So as my colleague has said, is that we are popularizing that, yes, there is a way for you at different points to know that your air quality is poor. And now when you go to the KCCA website, www.kcca.go.ug, you'll see there's a section of air quality, and you can in real time monitor the air quality in different parts of Kampala, where you'll actually tell that right now here the air quality is poor. So at one, we are saying that yes, now we can be able to tell you that the air quality is poor. But as part of this awareness, we are also able to tell you the causes of the poor air quality in Kampala. And engineers brought them out very clearly. We have the habit, and when you look at our measurements, there are points at which there are spikes. And we used to be intrigued at those spikes in the night. And I think many of us, when we go back home, the house girl found out what is home well, then we tend to burn our rubbish at some time in the night. So there are those spikes that are there. The other is, as you said, what kind of energy sources do we use? I mean, charcoal is one of the most common energy source that we use, but the process of using the charcoal, burning, all those lead to air quality. So we are telling people that much as it may not be feasible, it's bad enough, but also the health effects. When he gives you that number, it's kind of quantifying those small particles that are there in the air that are not visible. Now you breathe them in, they'll cause havoc to your lungs, and you find people will tend to have respiratory conditions. But even for the mother who is pregnant, those small particles have been known to cross that barrier and get to the baby, and you end up with low birth weight babies. And even children, they have been seen to impact on the cognitive development. So we are telling you the effects, we are telling you the causes, but we're also giving you that number for you to be able to know. So we are happy that we are here with you, and these are one of the outlets that we are using. And this afternoon we'll also be with my ED. That's and also again having another event to just tell people what the causes of air quality is and how dangerous. Surprisingly, when you look at our health statistics, the number one cause of what makes people sick is flu, cough, but there's no pneumonia. So that has to be something that is outside infectious in nature, which is making very many people unwell in Kampala. And from what we are seeing, it could actually be the quality of our air.
Okay, all right. Now, speaking of quality of air, our audience is asking, yes, maybe we can see that this is a bit dusty, but then this, as you had alluded earlier, that you cannot see the quality of air physically or visually. So then, Professor, I turn to you. In terms of quality of our air, how can we monitor it on a personal level?
Yeah, indeed, as Dr. Okello has emphasized, by the time you see that the air quality is poor, it has reached unmanageable levels, what we'd call hazardous. In many times, these particles are small enough. Just to give you the idea, if you take the human hair and you slice it up about 30 times, that's the size of these particles. So you can hardly see them with your eyes. By the time you see them, it means that these particles have concentrated and they have now become visible.
Oh, which is very dangerous.
Yeah, so that's why at Makerere University we've been working hard to see that we can create the technology to actually measure this air quality. And we have autonomous devices that we have developed and we have installed in different places across the country. And what these devices enable us is that they take air samples, they quantify it, and then we get the number, which represents the concentration of the air. The concentration, the lower the concentration, the better the air quality. The higher the concentration, the more polluted the air quality is. And then this data, as we get it in, we have provided also a number of digital platforms that have actually now enabled different stakeholders to access the data. So through your mobile app, you can be able to use the Airco app. If you go to any of the app stores, you look for the Airco app, you download it, and then with that you can actually be able to track the different locations and see how the air quality is.
And is this data in real time?
Yes, this data is available in real time. So as of this morning, for instance,
so if I wanted to find out the air of quality here at Serena, that app would give me real-time data of now.
As of now, you'll be able to know how the air quality is around this area, but also in other places that you might be interested in. You might be planning to have an outdoor activity in Jinja, so you can actually see how the air quality is in Jinja on your smartphone. All
right. Dr. Okello, in terms of Airco and what they're doing, I know that we do have some of these around Kampala, as he has alluded to, but the assessment of quality air here in Kampala and the health implications that you have talked about, as far as government is concerned and the authority in this particular case, where do we stand in terms of funding to cater to such things as cleaning up the air that people are breathing? In a city in which they're advocating for industrialization and all this modernization of things that are being taken on, there are no smoking corners, no smoking zones in this city, and so you do have the potholes and the dust and the roads that are being worked on in this entire area. You're going to be seeing all these affecting the quality of air.
Yeah, and you've raised up the issue of life and livelihoods, especially the argument comes about how do we industrialize, and because for human activity, the offshoot tends to be pollution in most cases. And when you look at the history of pollution, right from the industrial age when coal was being used and moving to where we are, but as I said, there's that compromise. So you may say, how do I industrialize? And then Dr. Okello is saying you're polluting the air. Luckily, there's what we'd call the cleaner production technologies which are available. And as KCCA, we have worked with the Uganda Manufacturers Association. We have worked with the Uganda Cleaner Production Committee. And for many of these companies, we have shown them how you can be able to produce your same product without an increase in costs, but not affecting the environment that much. The other, as we have said, is that we always go out to the public and tell people that it's actually, in the long run, it's cheaper to collect your rubbish than burn it. And as I'll say, that you continuously will burn your rubbish, then the chances of you getting in future respiratory conditions to treat them, the cost you'll incur is much, much higher than the cost you'll incur, probably 10,000 shillings or 5,000 shillings to get a waste collector to do that. So it's a matter of sensitizing people to, and we won't tire, and as government will continue sensitizing people for them to know that whatever action you may be able to do, there may be a consequence, especially for issues, as you say, like burning, for those that own factories or manage factories. There are consequences that go further than your area. So as government, that's one of the things we are doing, but also bring up laws for those that may not be able to follow, to know how they are, the laws to be able to guide people as should operate. But let me say one thing that is happening outside there. You've heard of something, they call it SANI. You know, it's the catalytic converter in cars. It's right now, it has become a very precious issue. People complain that when I take my car and park it somewhere to the garage, people are stealing them now. That catalytic converter is supposed to clean the air that comes out of vehicles. But as people now realize that on the market you can be able to sell it. And the more we keep on stealing these catalytic converters from cars, we are more or less making our cars more unsafe for each of us. So all the people outside there and those that are in that business, please stop, because as you say, the actions you're doing may actually end up on your doorstep without you knowing. Your child will fall sick, your grandfather will probably have a stroke because of what you're doing.
Okay, all right. Professor Bainomugisha, let's look at back in the time. There are things known to be very interesting for us in terms of what we use in our daily lives. One of those is wood. Charcoal is a source of energy, not just for Uganda, but most eminently here in Kampala. Looking at 1970, there was the Federal Clean Air Act authorized the Environmental Protection Agency to set the national ambient air quality standards for 6 common air pollutants. What are those 6 common air pollutants?
Yeah, the Federal Act, the Clean Air Act, that was in the US context. And it's one of the places where I've also been able to benchmark and learn some of the experiences through the partnership with the US mission here in Kampala. The key criteria pollutants that were identified then and have been studied a lot to show that these have a huge implication on health is the particulate matter that I've already talked about, the small particles that you know, small enough that will get into our body system. And they have 2 classes. There's particulate matter 2.5 and particulate matter 10. The number 2.5 and 10 stipulates or indicates the diameter of these particles, so how small they are. The 2.5 is like the microns, which indicates the diameter of these particles, very small. And then the other pollutants being the nitrogen dioxide, what we call the NOx, and then the sulfur dioxide, what we call the SOx, and then ozone. So those form like the key criteria pollutants that normally regulations to improve air quality will focus on these matters. And I know that you know, through the partnership and the collaboration with the National Environmental Management Authority, NEMA, there's already progress putting in place the national regulations on providing you know, guidelines on how we can regulate the pollutants that we've just mentioned.
Okay, Dr. Okello, I'm looking at downtown Kampala, which brings in millions of people, traffic on a daily basis, who have to eat food. Therefore, there's energy that has to be used to cook that food on a daily basis. When you look at such hotspots, you ask yourself the question of, they are definitely raising the Earth's average temperature every so often. Under KCCA, how are you addressing that? It's adding to the ecosystem. of both the commerce and the social development of the capital city, but yet at the end of the day, it has a dangerous impact to the very same people.
Oh, we have done something great. If you've been to downtown, there is what we call the non-motorized corridor. You know, running all the way from, I think from Loom Street, just above the park to Namirembe Road. And their cars are restricted and people are able to walk. So a few years ago, 5 years ago, it was teeming with a lot of activity because the upper bit was where taxis would park, getting to the old taxi park. But just that simple act of making sure that it's non-motorized, people can just be able to walk, has been able to reduce, as you say, the amount of emissions that are in that area. And that's one step that we have actually done. And as it says, the other is, yes, it may not be something that you may have now, but it is something that bit by bit government is picking up, and the issue is, can we be able to use probably gas instead of charcoal? I think last year or the other year, where government distributed cylinders to actually the population. And to me, that was the initial step to say, yes, the cost may be high, but with bigger numbers and an economy of scale, that may be something we may see ourselves moving to. So to me, that's an initial step by government to move there. So those who are cooking can be able to say, oh, why don't we try out this? There is this, which is, some people call it a contradiction, that if you tell people to use briquettes, you're still using biomass to burn because the briquettes are still coming from either something organic that you've actually used. But if you're looking at something that could be a better alternative to charcoal, cutting down wood, that may be something may be able to think about relative to the charcoal. So again, it's people realizing that briquettes could be if you're going incremental, if you're trying to reduce, move from charcoal, go to briquettes, and probably go to LPG. So those are things, again, we are trying to let people realize that those are the options that you may have available.
Okay, of course, the options that you're talking about come at a cost. The briquettes are sold in pieces, and you end up spending more, because if you're buying, say, 5-6 pieces at 6,000 and you use them every 2 days, they're finished. So the cost of keeping our air clean to the average Ugandan or Kampalan, for that matter, you do the mathematics and it's challenging.
I always tell guys that we live here in trust for the coming future. If I have to spend so much to make sure that my child or my grandchild can be safe, I think that's a worthwhile expenditure, rather than cutting the costs and then my child has no earth to live on, considering what you're talking about, because then I'm bringing him, or I'm creating an environment where probably he will be asthmatic, probably he will have a premature death, and that's where, if you don't do something, that's where we'll go. In other words, we are condemning the future generation to live much shorter lifespans than we have, because we'll be saying, no, I cannot spend on briquettes. I cannot be able to have that little more investment to secure our future for another reason.
Okay, that's interesting. Speaking of futures, I know, Professor, that Makerere University is repositioning themselves as a research and innovative center across Africa, and of course eminent to see the innovations that have come through your works and the works of the university. Let's talk about the future of capacity development when it comes to air quality and local solutions that can be adopted to tackle this particular issue.
Yeah, I think what we've been doing at ECON, particularly at Makerere University, is to have these examples of where innovations done at the university are helping to build the local capacity in tackling global challenges like air pollution in this case. And what we see is that over time, I guess we can say that we've been able to build capacity, or people are actually able to have knowledge on issues related to technology development, for environmental monitoring, capacity around how to use the data to improve air quality, inform regulation, and many others. But also, most importantly, as a university, when you have examples where you have developed the technology with the university, you have deployed it in the community, it's being used. It makes sense now to tell the students you are educating, like, look, what you are studying in class, this is how it can be applied, and this is how it can be used. So there's even more motivation for more students to get into these disciplines, to study and hopefully contribute to other innovations like ERCO.
Okay. All right. And finally, Doctor, in terms of effective ways of getting the rest of the community, the buy-in and the will to actually actively be sensitive in the awareness of the quality of air around them, how are you doing it under the authority?
And the biggest thing we have done is, and with the help of Makerere, is to be able to quantify, and that is to put a number. Because if I came and told you that the air quality is poor, you will say, how poor? What's that number to show that it's actually poor? So the audience outside there, the community, now we have a number that we can be able to compare against, and that came from us being able to measure. And to me, that is the first step that we have done. The other is to be able to quantify that, much as there is this number, what are those causes of that are making this number rise? And that we have also done, and we have shown you that car emissions, so you'll have that nitrous oxide from the car emissions. So we have also shown that when you burn your rubbish, this is what you'll actually be able to have. Because of the air monitors being in certain areas and you can link them to activities, you can be able to do that, such that we empower people to say that if I stop burning my rubbish, then I'm contributing to us having clean air. The biomass we are using, I'm contributing to us having clean air. So that is because it is through us having small individual actions that will be able to do this. There is no one magic bullet, and even then the power is with us. Government will facilitate, but the power is there with the community for us to be able to make our air clean, but also secure our future for our children and grandchildren, really.
Okay, all right. Thank you so much, Dr. and Professor, for giving us enlightenment on being aware of the air that you breathe in. And of course, ERCO is available on your Apple Store, your Google Store. Download it, and you can get to find out the quality of your environment in terms of air wherever it is that you are, and in real time, therefore making a very good decision to cater to your future and longevity, for that matter. We're going to be taking a short breather. When we return, Chris again is going to be looking at addressing the modalities in getting a driving license. It's been made easier thanks to technology, but of course we'll dive deep into how technology has advanced to driving licenses and of course the road transport by and large. Do stay with us.